leg, and you have any pain? No pain. Your right leg, you have any pain?
Yes.
Okay. You see, never apply the critical thinking. When your leg is numb and you are a diabetic patient, can you feel the pain?
Oh.
No.
When you answer also you must answer. Okay, never mind. Let's say she said right leg, left leg no pain, and this one also no pain. If I give 0, no pain, 1 to 10, which level is your pain? 1 to 3 is a more mild, 4 to 6 is not moderate pain, and 7 to 10 is severe pain. Which level? 0 is no pain. What? You say no pain, ma? 0 lah. So you put there 0, no pain. Maybe the pain is there, but she didn't feel because she having some neurological defect, right? So we do not. It's up to the patient. Depend on the patient. Okay, 0 or 1. If the patient say 1, maybe it's true 1. She can feel mild pain. It's up to the patient. Not necessarily must be 0. Then second part, go to the color. Color, you see normal, pale, cyanos, and mottle. So always you compare that with the normal leg. Normal left leg, color pink. Okay? So this is an affected leg. If you see pink, pink means normal. You tick there. Tick. You also put. That's why I asked you to carry the pink.
For the affected leg.
This is, you only compare, but your assessment is more on the affected leg. That means your right leg. You already put on top right leg, right? Put here right leg. So this finding is for the right leg, but left leg just give you the baseline comparison only. Okay. So if you see the leg is pale, then your finding should be pale. You tick at the pale. If you see the affected leg is bluish, then you put cyanos. A normal leg is pink, but affected leg is blue. That means cyanos. So you just do what you see on the patient. Okay, then move to the second part, warm. So always you touch the normal leg. Normal leg is
means the motor
like very cold, crampy, and then you can see some patch, some place like very pale, some place like very pinkish. You know, like when you too cold, you can see like circle around, like patch. Some patch is pale, some patch is pink. That we call mottle. So what you see, you
motor. I search MOTTL motor skin.
Later you find out. Now let me finish.
Okay.
Okay. 3 of you, if you all finish, you all can go back. Okay. I will give you all the quiz on. Are you all coming when? Tuesday. What time? But Tuesday, if you all come, I can supervise, but I unable to stay with you all. You have to practice your own, but I just CC because I have other students also. I just will CC only. Okay? Okay. Then I will give you all the quiz on Tuesday during the office hour. I don't want to give after office hour because you have your own personal problem, this and that. So I don't want all this, so I will open on during office hour. Next week only I open. Topic what I can't remember. I think pain assessment and pulse done right. BP, respiration, something like that. Tuesday you want to come 9 Okay, can. Okay. So next go to the warm. Warm, you touch. Okay, normal leg you feel warm. The affected leg you feel warm means you put there warm. If you feel cold means you put cold. Okay, what is your finding? So now, of course, she's normal. You will find the normal finding. Okay, so put warm. Hot or warm, okay? Pulse. Okay, for leg, which pulse we will check? For leg.
Distal pulse.
Distal pulse, yeah. What's the pulse name? For leg. Which is the part? Come, you show me. Okay, that pulse called what? Correct? What is the pulse called? So many times I mentioned before. Dorsalis pedis. Dorsalis pedis. You have to write there, you know. Pulse means which pulse? Radial pulse. Pedis. P-E-D-I-S. Pedis. Okay, dorsalis pedis. You have to put there, you know, because we don't know whether you check radial pulse or carotid pulse. We don't know. So you have to put dorsalis pedis pulse. Okay, can you feel? If you can feel, what is the characteristic? Strong, soft, weak, or anything, or absent. Okay. Normal leg, strong. Affected leg, strong or weak or absent. Okay, let's say if the pulse absence means there is a P there. What is your one of the 6 P? Pulselessness. Okay, so there's a P. Don't say that day you teach me the P, now don't have the P. Don't ask me. If absent of the pulse, that is pulselessness. There's a P there already. One P is the pain, second P is the pulselessness, then third P is the temperature. If temperature, that's called poikilothermia. Another P there. So it's hidden. So you have to think about it. You don't say anything, it won't be appear straight away in front of you. You have to think about it. So now the pulse is maybe I can feel but weak. So you put there weak. If it's strong, then you put there strong. Then weak. Capillary refill. Capillary refill, normal is what? 2 to below?
Less than 2 seconds.
Less than 2 to 3. 2 to 3 accept. So you do the benching test. 1, 2, 3, 4, 5. 1, 2. Okay. 1, 2, 3, 4, 5. 1, 2. Okay. Capillary refill, less than 2 to 3 seconds. So you write there. Less than 2 to 3 seconds. Right there.
Like right here.
Right. Yes, right. Okay. That is your 12 o'clock finding, right? Okay. When you finish this, you finish your blood circulation. Okay, for the patient, the blood circulation is normal. No problem, huh? Blood circulation is no. Now move to movement. Movement, we check for the nerve function. So, dorsiflexion. Patient cannot move, able to move or move with pain. Okay, can you move your foot to upward? Dorsiflexion means upward. Plantar flexion means downward. So can you always, your left leg, can you move upward? Can. Your left leg, right leg, can you move upward? Okay. Can you move downward? Can. Okay. Let's say this patient is coma. Okay? Coma. Can the patient follow the instruction?
No.
So you have to stimulate pain. So you use the sharp part here. Stimulate. Just prick. As you prick the patient, move. Okay. As I prick, you move backward. So move with pain. Okay.
2 extension is what?
But
Oh, haven't reached.
I haven't reached. Wait. Now only plantar flexion and dorsiflexion. So upward and downward. So this patient able to move. The mean able to move. This finding is able to move. And toe extension. Can you open up the toes? Open up. So can. So compare with. Can you open this leg? Can. Right leg? Can. So patient is normal. Let's say patient unable to move. Then you put unable to move. So what is your finding? Now the finding is able to move. So tick there. Tick. Okay. Toe extension. Okay, able. Then toe
Flexion.
toe extension, that means upward, the toes upward, the toes downward. Then she can do. So that's how you do. That for the movement. Okay, she has no movement also, no problem. All are perfect. Now we go to sensation. This one. Toe flexion, there, the fingers downward, the fingers, toes downward and upward. Extension mean up, flexion mean down, right? Flexion, flex down. And then we finish the movement. So patient have no blood circulation problem, patient have no movement problem. Now we go to the sensation. As patient complain, patient having tickling sensation, right? Okay, or numbness, tickling or numbness. So we go to the sensation part. Okay. Web phase first and second. How you going to start? Web phase first and second, toe, right? Toe. So this is the first, this is the second. So you check the normal. What you do, you use the sharp part, do like this. Okay, come and do like this. Do like this. In between. Okay. Do like this. Use the sharp part. Okay, do. Okay, can you feel? Can you feel I'm touching?
Yeah.
Okay, can you feel strong?
Yes.
Or you feel tickling? Or you feel like something numbness? Or no at all?
Can feel.
Ask the patient. Okay. Let's say now your problem is you're having numbness. So when I tap, you must say you feel numbness. Okay, not strong. Okay, now normal patient means strong. Okay, you feel this leg is a normal leg, right? Can you feel
Yes.
strong?
Yes.
Strong. Okay, this leg. Can you feel?
Now.
I can feel but numb. Feel numb, not strong. Not strong. Eh? Can you feel?
Yeah.
Can you feel strong?
No.
A bit numbness, like tickling. I can feel like something tickling. So it's not a strong sensation. So you document there tickling or numbness. Where? Okay. So this is not normal sensation, tickling sensation. Tick there. Okay. Now third and fourth. Third and fourth. Do the same thing. Not affected.
Between the
3
third
and 4, this space in between third and fourth here. Just now 1 and 2 right here. Now third and fourth here. So can you feel strong?
Yes.
Strong.
Tingling, mama感觉.
Tingling like numbness like that. The sense I touch you, you can feel, but not very strong. Like something is touching, but I don't know what is touching. Not very strong sensation. That we call numbness or tickling. Huh? Okay, here, can you feel?
Yes.
Very strong?
No.
How you feel?
Numbness.
Like something numbness. I can feel, but half like numbness. When you numb, you won't have a full sensation. You feel like partially sensation only, like numb. Okay. So here, so the finding is tickling. So numbness. Okay. So, there. After that, sole and foot. Okay, sole and foot is this part. This part, you use the sharp part, you draw a line here. Can you feel? Strong? Strong. Okay, same. Can you feel? Can you feel strong? Not strong. So what is your feeling here when I touch? When I touch, what is your feeling? Tell lah. You feel like numbness or tickling. Tickling. So you feel tickling. Okay, so you put there tickling. Then the last part is arch of the middle. Here, this part, this curve part. Curve. So from down you do. Okay, so you feel sensation? Yes. So come to here. Can you feel? Strong?
No.
Tickling. So we put there tickling. So in the exam also, I will stimulate the patient what to tell. So what the patient said, that is your finding, and put according to the what patient said. Okay. So finish. Swelling. Swelling. We compare both leg. One leg all same size. Same size?
Absent.
Yes.
Absent.
Then you can do the fitting edema. Press the bony part to double confirm. Okay, patient has no edema. So absence. Okay, what is your comment here? Patient complain of tickling sensation. To inform doctor or doctor inform or whatever your comment. Then your initial. Okay, then by this patient is an hourly neurovascular assessment. Then 1 o'clock you have to do again the same thing. Maybe changes can happen. Now patient said a tickling sensation. Maybe after 2 hours, 3 hours, patient can say no feeling, right? No feeling at all. Changes can happen, right? Now the pulse you check is weak. Maybe after 2 hours, absent. Changes can happen. So that's why we have to do neurovascular assessment. Depend on the patient condition, hourly or 2 hourly or 4 hourly as patient needed. Okay, so this is how you're going to do if Oski come up.
Okay.
Okay? Alright,
Okay.
thank you. I leave you.
Bye.